Okay, so imagine this, right? It's Monday morning, and we're at a busy hospital, downtown somewhere.
What's going on?
Tons going on. Patients are checking in for surgery. The ER is probably already like overflowing.
Oh, yeah.
The waiting room is just packed. And then, to make matters even worse, cancellations start coming in.
Oh, wow.
An ambulance shows up with a critical case, and one of the specialists is like super late.
He's like a cascade.
Total chaos, right?
Okay.
But organized, I guess.
You got it. Hospitals are just these really complex systems.
Absolutely.
And there's always pressure to use resources the best way possible.
And like traditional scheduling systems, they're just not really built for this, right?
No, they just can't keep up.
What if you could somehow like predict how many patients would be coming in and optimize the staff and equipment and even like adapt in real time to all those crazy changes?
Sounds pretty ideal.
Right. Well, Metropolitan Hospital in Boston, they actually did it using AI. They got this system up and running that cut down wait times by a crazy 35%.
Wow.
Yeah. And they somehow boosted patient satisfaction at the same time by 50%.
That's amazing. Yeah, Metropolitan really changed the game when it came to scheduling.
Totally. So let's dig into how they pulled this off. So before this whole AI thing, Metropolitan was having some serious issues like a 20% no-show rate
Oof.
and wait times like way over 45 minutes on average.
It's rough when you're the one waiting.
Totally. And then think about the staff. They were spending like almost 20% of their time just on scheduling stuff.
Time that could be spent with patients.
Right, exactly. It was pretty obvious they needed a major change. So that's when they came up with this intelligent scheduling optimization system, or ISOS for short. It's basically like this massive computer brain analyzing everything going on in the hospital.
Yeah. And ISOS uses what we call predictive analytics to make guesses about things like how many patients are going to show up and how long appointments will take.
Yeah.
It looks at like old data, and what usually happens in certain seasons, and even like the weather.
Really? The weather too?
Yeah. It's similar to how like Netflix figures out what shows you might want to watch next.
Huh, that makes sense. So it's using all this data to like kind of see into the future a bit, but how does that actually make the scheduling better?
So that's where the second part of ISOS comes in, resource optimization. The AI takes into account all of the staff, their skills, who's available, the equipment needed, and even like the layout of the whole hospital.
Wow, to make sure like everything's running as efficiently as possible. So it's like a really good chess player, right? Always thinking a few moves ahead.
That's a perfect analogy.
But then what about all the like unexpected things that pop up?
Sure.
Emergencies, cancellations, doctors running late, that kind of stuff. How does ISOS deal with that?
Okay, so that's where the third part comes in. And it's probably the most impressive part. Real-time adaptation. So imagine ISOS is like an air traffic controller, but for a hospital.
Keeping everything moving smoothly.
Right. Always watching the situation and making adjustments when things change.
So if like a surgeon is running behind, ISOS could just like automatically shuffle some appointments around.
Exactly. Or maybe even reassign some of the nurses or send out quick notifications to patients.
That's wild. It sounds like something straight out of Star Trek or something.
Yeah, the technology is pretty amazing. But getting it all to work in a real hospital, that was a huge project.
Absolutely. Because it's not just about the tech, right? It's about people, too.
Oh, for sure. Metropolitan knew that to really make this work, everyone had to be on board.
So they didn't just like install the system and expect everyone to figure it out on their own?
No way. They started slowly. They did a little pilot program just in one of their outpatient clinics.
Just to like test it out.
Exactly. See how it worked, work out any problems.
Makes sense. Start small and then go bigger.
That's the idea. And they also put a ton of effort into training their staff. Lots of workshops and practice sessions, so everyone felt comfortable using the new system.
And I think I read somewhere that they also had a system set up to kind of like keep an eye on how ISOS was doing and make changes along the way.
Yeah, definitely. Because, technology is always changing and improving. They had to be ready to adapt.
So it sounds like they were really successful because they had a good plan, good leadership, and they were always willing to, learn and make things better.
Exactly. They understood that implementing AI, it's not just about the technology itself, but about creating a culture where people are open to trying new things and working together.
Yeah, that makes sense. So I guess the next big question is, did it actually work? Like, did ISOS really live up to all the hype?
Well, I think the results speak for themselves.
Let's hear them.
All right, so remember all those long wait times we were talking about earlier? Well, with ISOS, they were able to slash them by a whopping 35%. Think about that. Being able to see a doctor that much faster.
I mean, that's a huge win for both the patients and the hospital itself.
Totally. But what about that, what was it, that 20% no-show rate? Did ISOS make a difference there too?
I'm dying to know.
Well, you're going to be happy to hear that it absolutely did. That 20% no-show rate plummeted to a measly 8%.
That's incredible. So not only are they seeing patients faster, but they're also seeing more patients because fewer appointments are being wasted.
Exactly. It's a win-win situation all around.
But what about the impact on the staff themselves? I mean, we were talking about how much time they were spending on scheduling before.
Right, right. Well, ISOS actually freed up a significant chunk of their time. Remember how they were spending nearly 20% of their time on scheduling tasks? Well, with ISOS, they managed to reduce that by a whopping 80%.
80%. That's amazing. So now doctors and nurses can actually spend more time doing what they do best, taking care of patients.
Exactly. And it seems like ISOS really had a ripple effect, creating positive changes throughout the whole hospital.
Yeah, it's not just about efficiency. It's about improving patient care, staff satisfaction, and even the hospital's bottom line.
You got it. It really shows how powerful AI can be when it comes to optimizing complex systems and creating a better experience for everyone involved.
Absolutely. I mean, this is really exciting stuff. It's just one example of how AI is transforming healthcare. But like any powerful technology, I imagine there are some, important things to think about along the way.
Oh, absolutely. We have to be careful and responsible.
Right. Because it's not just about like building cool technology for the sake of it.
Definitely not.
It's about using it in a way that's safe, effective, and aligns with our values.
Exactly. And that means carefully considering things like data privacy, making sure the algorithms aren't biased, and thinking about the potential impact on the people who work in healthcare.
Yeah, data privacy is a big one. I mean, with all this patient information being used, how can we be sure it's being protected when we're using systems like ISOS?
That's a really important question. And healthcare providers, they need to take this very seriously. There are a lot of steps they can take to protect data, like de-identifying it, encrypting it, and making sure only the right people have access to it.
So it's like building in safety measures from the very beginning
Right.
and making sure the data is handled responsibly every step of the way.
Exactly. Data privacy is crucial. It needs to be built into the foundation of any AI system used in healthcare.
Makes sense. What about this idea of algorithmic bias? We hear a lot about how AI algorithms can sometimes reflect the existing biases that are already out there in society.
Absolutely.
How do we make sure that doesn't happen in healthcare?
That's another critical thing to think about. Algorithmic bias can come from like biased data used to train the AI or even in the way the algorithm itself is designed. So to minimize this risk, it's important to use data from a lot of different sources, carefully check the algorithms for any potential bias, and have ways to constantly monitor and audit everything.
So we need to be proactive.
Right.
And really try to find and address any potential bias before it becomes a problem.
Exactly. We need to be vigilant and ensure that these AI systems are promoting fairness and equity in healthcare.
Okay, and one last thing I wanted to ask about. What about the impact on the people who work in healthcare?
Yeah.
There are some people who are worried that AI will end up replacing doctors and nurses. What are your thoughts on that?
Well, personally, I think AI has the potential to really help healthcare professionals, to make their jobs easier and better, not to replace them. AI can take care of repetitive tasks, analyze huge amounts of data, and give insights that can help doctors make better decisions.
So AI as a tool, not a replacement?
Right. But it's important to remember that it is a tool, and it needs to be used wisely and ethically by people who are skilled and trained.
So it's not about robots taking over. It's more about humans and machines working together to improve healthcare for everyone.
Exactly. The future of healthcare is about humans and AI collaborating and using the strengths of both to do amazing things.
This has been super insightful. We've covered so much ground already.
I know, right? From how ISA's got those incredible results to all the ethical things we need to think about when it comes to using AI in healthcare.
Before we wrap up this part of our deep dive, though, I want to shift gears a bit. We talked about how AI can improve scheduling and even personalized treatment plans. But what about predicting health problems before they even happen? Is that something we're close to being able to do?
Absolutely. That's the idea behind something called predictive diagnostics, where we use AI to analyze patient data and identify potential health risks before they turn into serious problems.
Wow. That's amazing. It's like having a crystal ball that can tell us about our future health. Imagine being able to predict things like heart attacks, strokes, or even certain cancers, before they actually happen.
Early detection is key to successfully treating so many conditions. The ability to identify who's at risk and step in early could completely change how we approach healthcare.
It could potentially save so many lives and bring down healthcare costs in the long run.
Exactly. And we're already seeing some promising progress in this area. Researchers are using AI to look at medical images, genetic data, and even lifestyle factors to find patterns that could point to future health issues.
That's incredible. But like with any powerful technology, there are probably some risks and ethical things we need to be aware of, right?
Of course. One of the biggest concerns with predictive diagnostics is the possibility of false positives, where the AI system mistakenly flags someone as being at risk for a condition when they're actually not.
And then there's also the risk of false negatives, right? Where the system misses a real health problem.
Exactly. And both these can have serious consequences. So it's incredibly important to create AI systems that are accurate, reliable, and trustworthy.
So how do we make sure these systems are making the right predictions and not causing unnecessary worry or harm?
It all comes down to rigorous testing and validation. We need to make sure these AI systems are trained on large, diverse data sets and thoroughly tested in real-world clinical settings.
So it's not just about building the technology, but also making sure it's used safely and effectively.
Absolutely. And that requires collaboration between data scientists, clinicians, and regulatory bodies.
This has been such a fascinating deep dive so far. We've explored so many ways AI is changing healthcare, from making scheduling smoother to predicting health risks and personalizing treatments.
It's been a pleasure sharing these insights with you. The potential of AI in healthcare is vast, and we're only just beginning to tap into it.
As we wrap up this episode, what's the one key takeaway you hope our listeners will remember?
I think the most important thing is that AI has the power to revolutionize healthcare, but we need to approach it responsibly and make sure we're using it for the benefit of everyone.
Well said. And to our listeners out there, thank you for joining us on this deep dive into the world of AI and healthcare. As you can see, it's a complex and rapidly evolving field. But with careful thought and collaboration, we can use the power of AI to create a healthier and more equitable future for all.
Yeah, and that's what's so cool about the Metropolitan Hospital example. It wasn't just about, throwing in this fancy new AI system.
Yeah.
They really focused on the people
Right.
and made sure everyone could handle the changes.
It sounds like they really got everyone involved.
Well, yeah.
But okay, let's get to the results.
Okay.
Did IceSauce actually work the way they hoped?
I think the numbers speak for themselves.
Okay, lay it on me.
So remember those crazy long wait times?
Oh, yeah, definitely.
IceSauce helped cut them down by a whole 35%.
Wow.
Imagine being able to see a doctor that much quicker.
That's a game changer for everyone. What about that no-show rate? Did IceSauce have any impact on that?
Oh, yeah, absolutely.
Okay, tell me.
That 20% no-show rate we talked about dropped to just 8%.
Seriously?
Yeah, that's a huge boost in efficiency.
So they're seeing patients faster, and they're also seeing more patients overall.
Yeah.
Because fewer appointments are being missed.
Exactly. It's a win-win.
Totally. What about the staff, though? How did this affect them?
Oh, IceSauce gave them a lot of their time back. Remember, they were spending almost 20% of their time on scheduling.
Yeah, a ton of time.
Well, IceSauce cut that down by 80%.
80%? No way.
Yeah. That means nurses and doctors can spend way more time actually caring for patients.
That's incredible.
Right.
It seems like IceSauce had this ripple effect of good changes throughout the entire hospital.
I think so.
Improving patient care, making staff happier, and even helping the hospital's finances.
Yeah, for sure.
It really shows how AI can be used to improve these complex systems.
And to make things better for everyone involved. This is just one example of how AI can be a game changer in healthcare.
Yeah, totally. But I guess with any really powerful technology, there are some things we need to be careful about, right?
Oh, yeah, definitely.
It's not just about building cool tech for the sake of it.
No,
We have to be responsible about it,
Yeah.
use it in a way that's safe, effective, and, doesn't go against our values.
Exactly. And that means we have to think carefully about things like data privacy,
Yeah.
algorithmic bias, and how AI might affect the people working in healthcare.
Yeah, data privacy is a big one.
Huge.
With all this patient information being used, how can we be sure it's protected when we're using systems like IceSauce?
That's a really important question.
Mhm.
And healthcare providers need to take it seriously.
Yeah.
There are a lot of things they can do to protect that data,
Like what?
like de-identifying it, encrypting it, and having strict rules about who can access it.
So it's about putting those safeguards in place right from the start
Right.
and making sure that data is always handled responsibly.
Exactly.
Okay, that makes sense.
Data privacy is non-negotiable. It has to be a core part of any AI system used in healthcare.
Okay, what about this idea of algorithmic bias?
Mm-hmm.
You know, we hear a lot about how AI algorithms can sometimes pick up the biases that already exist in society.
Yeah,
How can we prevent that from happening in healthcare?
that's another really crucial thing to consider.
Yeah.
That bias can come from a few places, like if the data used to train the AI is already biased, or even the way the algorithm is built.
Oh, wow.
So to minimize this, it's important to use data from a variety of sources, really scrutinize those algorithms for any hints of bias, and have systems in place to monitor and audit them regularly.
So we need to be proactive, not just wait for problems to pop up.
Exactly.
And finally, what about the impact on healthcare workers themselves? Some people are worried that AI will take over the jobs of doctors and nurses.
Right.
What are your thoughts on that?
I actually think that AI has the potential to help healthcare professionals, not replace them. To make their jobs easier and more effective.
Okay.
AI can handle those repetitive tasks,
Sure.
analyze tons of data, and offer insights that can help doctors make better decisions.
So AI is more like a tool.
Exactly. A tool that needs to be used ethically and by skilled professionals.
Right, not a replacement.
Right. The future of healthcare is about humans and AI working together, using the strengths of both.
It's a partnership.
Exactly.
This has been so insightful. We've covered so much.
I know, it's been great.
From the amazing results of ISOS to all the ethical stuff we need to be thinking about when it comes to AI in healthcare.
Definitely a lot to consider.
Before we wrap up this deep dive, I want to circle back to something we touched on earlier.
Okay.
The potential for AI to personalize healthcare.
Hmm.
What exactly does that mean, and how is AI making that possible?
Personalizing healthcare is about tailoring treatments to each patient's unique needs,
Okay.
moving away from this one-size-fits-all approach.
Right.
And AI is a key player in making this happen.
Hus.
Well, for example, in precision medicine, AI is being used to analyze huge amounts of patient data, like genetic info, lifestyle, medical history, all of it, to figure out the most effective treatments for each individual.
So instead of relying on these general guidelines, doctors could use AI to personalize treatment plans.
Exactly.
Based on each patient's specific situation.
It's all about getting away from that one-size-fits-all model.
Wow, this is incredible.
It is.
It's like having a personal health advisor powered by AI, helping doctors make the best decisions for their patients.
And it goes beyond just treatment decisions.
Really?
AI can also be used to personalize preventive care,
Oh, interesting.
giving people specific recommendations based on their individual risk factors
Yeah.
and health goals.
So instead of just giving everyone the same generic advice about diet and exercise, we could use AI to create personalized plans.
Exactly. Tailored to an individual's genetics, lifestyle, even their preferences.
This is truly amazing. It feels like we're moving away from this reactive healthcare system where we wait for people to get sick to a system that's more proactive, focusing on preventing illness and providing personalized care.
Absolutely.
And AI is a big part of making this shift possible.
Yeah, it's an exciting time to be watching all of this unfold in healthcare.
It really is amazing to think about all the possibilities.
Yeah, definitely.
We've talked about how AI can improve scheduling, personalized treatments, but what about actually predicting health issues before they even show up? Is that something that's like on the horizon?
Oh, absolutely. That's the whole idea behind predictive diagnostics, using AI to analyze all that patient data and spot potential problems before they turn into something serious.
So it's like having a crystal ball that can give us a glimpse into the future of our health. Imagine being able to predict heart attacks or strokes or even cancer before they even happen.
Early detection is key when it comes to treating so many conditions.
Right.
Being able to identify those at-risk individuals and intervene early could be a game changer.
It could potentially save countless lives.
Yeah,
And even significantly reduce healthcare costs in the long run.
absolutely.
And are we actually seeing any real progress in this area?
Oh, for sure. There are already some really promising developments happening.
Like what?
Well, researchers are using AI to analyze medical images,
Okay.
genetic data, and even lifestyle factors to find patterns that might suggest future health problems.
That's incredible. But I mean, like with any powerful technology, there are always potential risks and ethical concerns that come along with it, right?
Of course.
What are some of the things we need to be mindful of?
Well, one of the biggest concerns with predictive diagnostics is the chance of false positives.
Hmm.
That's where the AI system might incorrectly flag someone as being at risk for a condition when they're actually not.
Oh, I see. And then on the other hand, there's the risk of false negatives too, right? Where the system might miss a real health problem.
Exactly. And both false positives and false negatives can have serious consequences. So it's crucial to make sure these AI systems are really accurate, reliable, and trustworthy.
So, how can we be sure that these systems are making the right calls and not causing unnecessary worry or harm?
It all boils down to rigorous testing and validation.
Okay.
We need to make sure that these systems are being trained on large, diverse sets of data
Hmm.
and that they're thoroughly evaluated in real-world clinical settings.
So it's not just about building the technology itself, it's about ensuring it's being used responsibly and effectively in actual healthcare settings.
Absolutely.
Well, this has been a truly fascinating deep dive.
Yeah,
Yes, we've explored so many ways that AI is changing the landscape of healthcare,
we have.
from streamlining how patients are scheduled to predicting potential health risks and personalizing treatment plans.
It's really amazing to see how far we've come.
It really is.
It's been a pleasure sharing these insights with you.
Likewise.
The possibilities of AI in healthcare are vast, and we're just scratching the surface.
Absolutely. So as we wrap up this episode, what's the one key takeaway you'd like our listeners to walk away with?
I think the most important thing to remember is that AI has incredible potential to revolutionize healthcare,
Hmm.
but we need to approach it thoughtfully and make sure we're using it responsibly for the benefit of all.
Well said. And to our listeners out there, thank you so much for joining us on this deep dive into the world of AI and healthcare.
Thanks for listening, everyone.
As you've heard, it's a complex and rapidly evolving field, but with careful consideration and collaboration, we can harness the power of AI to create a healthier and more equitable future for everyone.